Okay, Mary Rose Burke, thanks for joining us. What is your job? What is your title? What do you do?
Currently, Rory, I'm Chief Pharmacist with Boots. I've been in this role for nearly 6 years now. So effectively that means I look after all the professional side of the business and everything about designing the pharmacy service to deliver the best care to our patients and customers that come in for pharmacy or healthcare services.
Very good. How has the traditional role or view of pharmacy changed over the years?
I think the role as pharmacist and the external view of the pharmacist has changed significantly, but mostly in the last few years. The traditional model of pharmacy around dispensing your medicines has always been and will continue to be a core part of the pharmacy profession. But increasingly, pharmacists are being trained to deliver extended services. And we found, particularly in Boots, with the launch of 2 services this year, that the patient acceptability for, we say, flu vaccine or emergency contraception in pharmacy was huge. And that gives us confidence that patients do want more services delivered by their pharmacist in their community.
Mm-hmm. So would it be fair to say that what you want is for people to think pharmacy or pharmacist first rather than their GP?
Absolutely. I think if you were to sit and look for a population of 4.5 million, what would be the best way to design services across a rural and urban community? You would look and try to have as many points of contact as possible. And currently we have that. We have 1,700 pharmacies spread evenly across the country where people can walk in at any time. The pharmacist is available and accessible and has the expertise they need. So I would like people to think, yes, go in and ask for information. The pharmacist will either be able to help them and provide appropriate treatment, or will signpost them onto the relevant professional in the community.
Very good. Now, what do GPs think of this? You must have done some research on it.
Well, GPs and pharmacists have a very good working relationship. Every GP and pharmacist would talk a number of times during the day around their patients. So I think on a day-to-day level in the community, the various professionals work reasonably well together and would have good both personal and interprofessional relationships. But it's at a national level that we need to get a design of services that is an interdisciplinary design of services around the patient, so that it's not about pharmacy saying we can do this and GPs saying we can do that. It's about us all coming together and saying, what do the people that we serve need in their communities, and how do we redesign our services and work together in an integrated way to look after the communities better.
So going forward, Mary Rose, you would see this happening?
I think so, and I think it's maybe one of the silver linings in the current crisis. We can't continue to run the health services in Ireland the way we have in the past. So I think that very pressure is going to cause people to think in a different way, to break down the old ways of doing things and say, look, let's start, here are the patients, here are the needs, here are our resources, and what can we do with them to deliver care in the best way possible.
Okay. Now, when most people think of pharmacy and a pharmacist, I think it might be fair to say that they think of, or that they will see, an expert in pills and potions, but maybe not necessarily an expert in the diagnostic process. Would that hinder this plan?
Well, I think it's very fair to say that the pharmacist would be seen as an expert, and indeed is that expert on medicines and drugs in the community, and that will always remain a very core part of the pharmacy profession. But increasingly, and we now see with the new training courses in 3 schools of pharmacy, that young graduates are coming out now with masters in pharmacy, and they're both trained and competent to deliver extended services in the community. So I think you're going to build on that base of trust that already is there in the pharmacist as an expert and bring on these new services. So I think we're in a period of transition in pharmacy at the moment. Okay.
Now, again, if you go into your pharmacist, say for instance with a typical condition of a dermatological problem, so a skin problem, take us from there. What would happen?
Well, this would be a very typical presentation into a pharmacy where a patient will come in, or a parent with child, to look at a rash. And very much I think in the current climate as well, if people are going to incur the cost of going to a GP, they want to know that they really did need to go. So they'll come into the pharmacy and they'll be taken by the pharmacist into the consultation room, particularly if it's something sensitive. The patient doesn't necessarily want to expose parts of their skin in the pharmacy. So they'll go into the consultation room, sit down with the pharmacist, and they'll have a look at the rash. Now, rashes can be from one into the other. They can be anything. So the pharmacist will have a look. If they can diagnose it, which with many very common skin conditions, they'll be able to diagnose and treat appropriately with the pharmacy supplied medicine. And in other cases, they may need to refer to the doctor, particularly maybe if it's a skin condition that might need an antibiotic or something like that. But those are areas where pharmacists could deliver more with changes in legislation, with more medicines maybe becoming available to the pharmacist for pharmacist prescription and supply in the pharmacy. So that would be a very typical journey where to treat if appropriate and refer on if necessary.
Very good. Now there's not necessarily a cost or a fee for this, is there?
No, the pharmacy model to date has been built on the dispensing and the professional service and distribution model there. We do need to move into an area where pharmacists are appropriately reimbursed for the expertise and their service. So if you have 10 or 15 minutes of a pharmacist's time, obviously somewhere funding needs to be looked at either by the patient themselves or by a third party, be it insurer or health service. But the thorny issue of funding always does have to come into the design of a health service.
So that's something else you'll have to explore as you go forward on this.
We'll have to explore, but certainly in Boots, our own experience last year of launching a flu vaccination service was that it was hugely acceptable to patients to be able to walk in or make an appointment, have their vaccination delivered by a pharmacist, which was the first time in Ireland that pharmacists could do this, and they paid for the service. Customer satisfaction with both the quality of the service and also with the price point was unanimous. They very much supported it and felt we offered value for the charge that they paid.
Mm-hmm. Again, the old traditional view of pharmacy is you walk in and you have your big dispensary desk and you have a little public desk.
Okay.
Now, judging by what you've said so far, you're telling me that you've now built private rooms where people can actually go to.
Yeah, the sector in general and Boots in particular, we have looked at the patient journey a little bit and tried to remove barriers. So we knew from customer panels and that privacy was an issue. So consultation rooms have been put into all our pharmacies, and indeed the legislation now demands them. So all pharmacies do have a private consultation facility. But also we understood from patients that the old idea of the elevated dispensary at the back where the pharmacist could observe everything was perceived as a barrier. The counter is perceived as a barrier. So we're doing everything we can, particularly we've lowered our floors so they're the exact same level. The pharmacist does face-to-face dispensing so that the bench is no longer a barrier because you consult over it and you can talk there and then. So we're trying to demystify and take this mystique out of the pharmacist going in the back to the pills and potions, to the pharmacist being there talking to the customer and supervising the entire dispensing process as opposed to being actually doing the counting of the tablets as such. So it's a change to redesign around the patient need.
Okay. What would your message be to people watching this broadcast?
My message to people would be to say you have a highly expert healthcare professional in the community that you can walk in and see without appointment, and they will either be able to help you themselves or they will be able to appropriately refer you. So make pharmacy your first port of call.
Mary Rose Burke, thanks for joining us.
Thanks, Rory.